All right. Good evening, everyone. My name is Matt Losak. I'm the Executive Director of the Montgomery County Renters Alliance. This must be our 20 some odd renter town hall. And I welcome all of you, including our panelists. Let me tell you a little bit about the Renters Alliance if you don't know us. We were founded in 2010 as an independent nonprofit dedicated exclusively to renter outreach, education, organizing, and advocacy. We are working in apartment communities all over Montgomery County. We advocate for individual tenants in dispute with their landlords. We work collaboratively with other nonprofits and with the county enforcement agencies. And we try to provide as much information to renters about their rights and responsibilities where we can. And we also advocate for the improvement of policies and legislation that protect renters and advance renters' rights. Last week, we had a press conference with an organization that we co-founded called Renters United Maryland. That is a coalition of about 30 plus nonprofit organizations and civic activist groups to advance a package of legislation in Annapolis this year called the Housing Justice Package that includes a number of pieces of legislation. And so if you want to track what we're doing, you take a look at our newsletters. If you're on this call, your email will be added to our database and you'll receive our newsletters from time to time with information. Tonight we will have a couple of presentations, a number of presentations, I should say. First by the county's health staff and then by Department of Housing and Community Affairs as well. If you have questions, we ask you to put them in the chat. And we will address the questions at the end of the presentations and monitor that as we go. This is Renter Town Hall is being recorded and will be put up on YouTube later if you want to go back and enjoy us, our company one more time. So right now, let me say we have with us today, an honor to have with us Dr. James Bridgers from the Deputy Health Officer for the Health and Human Services Department. And Sean O'Donnell, who's a manager with the Emergency Department. We also have with us the Deputy Director of Housing and Community Affairs, Frank DeMarais, the Manager of the Office of Landlord and Tenant Affairs, Rosie McCray Moody, Supervisor with the Code Enforcement Department, Keen Nichols, and assisting me, the very loquacious Lorraine Driscoll, who's going to be helping me answer questions and keep track of us this evening. So with that, I know we have a lot of burning questions on housing issues, but because of the vaccines information evolving and so critical to us right now during this pandemic, we thought it's important that renters, many of whom represent some of the most vulnerable residents in our county, should get direct information on the vaccine distribution operation, its status, and how to track it for when your time comes in the line. So with that, it's my pleasure to introduce Dr. James Bridgers. Dr. Bridgers?
Good evening, Mr. Losak and all panelists who are participating in the town hall today. And good evening, all. Happy holidays and season's greetings. And I just want to say before we begin our presentation and the discussion, I want to thank you for all the support you provided to the county's Department of Health and Human Services and Public Health Services as we began and ramped up our testing capacity, and now we're moving into our vaccination capacity and managing the vaccines that we receive from the Maryland Department of Health. And so I'd like to share my screen for all who have access. I'll also put the link in the chat box for our COVID vaccine portal. It provides a lot of information that may answer many of your questions. However, we are available and will continue to make ourselves available to help educate and inform the community on our vaccine process. And so at our vaccine portal, it's in multiple languages, as you can see. It gives a brief description about what we're doing and how the vaccines play a crucial role in helping to end the pandemic. And we still have a bit of a ways to go as we continue to vaccinate the community. Mr. Sean O'Donnell is our Public Health and Emergency Response Manager, and he will go through the operational aspects of our vaccination process, as
Dr.
well as
Bridges,
the,
Dr.
yes,
Bridges, just quickly, if you could lean forward, your audio is going in and out. When you're
okay,
forward, we can hear you clearly.
okay. How's this? Is this better? Great. Okay. So to continue, he's also going to talk about those levels of prioritizations that you've heard about, healthcare professionals, primary care professionals, those age categories that fall within that first tier before the actual public gets into the vaccination scheme. And so on this page, I'll quickly go through it. It tells you when the vaccine will be available. This page is updated, if not daily, multiple times during the week as we receive information either at the federal or state level. How does the vaccine work? Who should get it? What are those priorities of distribution? And so we've kind of put together an information to answer those questions that continuously and seems to be ongoing, which is justifiable in the community. And so those prioritization groups that I've talked about, we have the expected distribution categories based on phase 1, phase 2, and phase 3. We've also provided the overall plan for the state of Maryland, which each local jurisdiction had to adapt their vaccine plan based on the overarching plan from the Maryland Department of Health and at the state. And then it also has information on the Advisory Committee on Immunization Practices and Recommendation, which sets the standardization and prioritization of the vaccines to make it fair and equitable across all of our communities. And so those are some of the fact sheets that we have online, and I'll stop sharing now. But I just wanted to give you an overview. Feel free to visit those pages if you have any question. Always feel free to follow up with our public health services, and we will provide the answers again or as best as possible. If you have any questions, you can also dial 240-777-1755, which is our COVID-19 call center, and they should be able to answer questions or find the questions for you and follow up. And so having said that, many of you have heard that early on in the month of December, Pfizer Pharmaceutical received their emergency use authorization from the Federal Drug Administration, which allowed them to distribute their vaccine. A couple of weeks later, Moderna Pharmaceuticals received their emergency use authorization to distribute the vaccines in the communities and throughout the United States. Now, this has been a slow process, and we're working with the Maryland Department of Health to receive those vaccines. We received 100 doses last week. We received about 4,000 doses this week. The Pfizer vaccines have been earmarked and have been distributed to the 6 hospitals in the county and our long-term care facilities, assisted living facilities. They have been earmarked for the Pfizer vaccine. In partnership with the local pharmacies, the pharmacies will be assisting the long-term care facility with their vaccination process. And so as we continue to build our system, we have an operational process in place to handle scheduling. We sent a provider survey out to our providers in the county. We also sent it to the Medical Society of Montgomery County to help identify those primary care providers and their staff, healthcare providers, other providers who are not in a hospital system. The individuals who received the vaccinations in the hospital principally were the emergency room staff and the ICU staff, and then afterwards their outpatient and ambulatory clinics within those hospitals. And so we're working aggressively, progressively with our community providers to increase our vaccination process. Sean will talk about the clinics that we're standing up based on the doses that we receive on an initial basis. Now, remember, we received the dose of 100. We received 100 doses last week to test the system. The registration system that Sean will talk about is called PrepMod, where folks will go in and enter their information and schedule an appointment based on their level of prioritization, and then select an area. We are identifying vaccination spots. The goal now is to identify a vaccination space in Up County, in Mid County, and Lower County. We vaccinated first responders, primary care, healthcare providers today at our White Oak Community Center. We will be at White Oak Community Center tomorrow, and at the Public Safety Training Academy. We're also partnering with Kaiser to vaccinate our healthcare professionals, our first responders, because they comprise a significant number of individuals, healthcare professionals in our 1A category. And you may have heard some of the partnership that Washington, D.C. and Northern Virginia partner with Kaiser to test their first responders. And we are in the process of working with them to not only vaccinate our first responders as well. And then lastly, Dr. Gales has been talking to our hospital chief executive officers, since they are going through their vaccination process with their staff. As they have openings and support, they too will help out with our 1A category, which has the highest level of prioritization as far as groupings, which includes our vaccinators, folks who are in the community, providers, front-facing staff, individuals in home health care settings, and Sean can go into a little more detail with that. So that's kind of a 30,000-foot overview with what we're doing and where we are. We've tested maybe around 1,400 folks. It may be slightly lower, and there's been no adverse reactions. We have emergency medical teams available on staff who are not only there to support us, but also serving as vaccinators. So all the individuals who are vaccinating or who will be vaccinating have been vaccinated themselves throughout this process. So I'll stop there and I'll turn it over to Sean, who can go into operational aspects and give us a crosswalk on those prioritization, the operations, the scheduling, etc. Thank you so much.
Thank you, Dr. Bridgers. And thank you all for allowing us this opportunity to share some of this information from you. If you can see me, I am calling from my car. I just came out of our first large vaccination clinic. It is still going on for another half hour. We, as Dr. Bridgers mentioned, our focus right now is on the 1A population, the healthcare population. And within Montgomery County, that is a fairly sizable population. We have, by our estimates, about 50,000 healthcare workers across the county in all different types of jobs. The partnership between the pharmacies and our long-term care and our hospitals probably account for about half of those folks. And the other half we are working to vaccinate. We have only received 4,300 doses of the vaccine to date. So as you can tell, there's probably a much, much, much higher demand than what we have for vaccine. But we're at the very earliest stages. We are only a few days after these vaccines have been approved for emergency use authorization, which is likely a record time from that pronouncement to having vaccine in the hands of local vaccinators. We're working very hard to have the vaccine administered out to the right groups as quickly as possible from when it comes in, and maintain the appropriate safeguards so that that vaccine is effective, and we maintain the very high level of efficacy that was shown in the clinical trials. just wanted to give you a little overview that in addition to what we're doing with vaccinations, we are all still maintaining our outbreak investigations, our contact tracing, our community testing. If you go to our website, you'll see there are sometimes between 20 and 30 locations that are publicly coordinated along with other partners in the county for testing, as well as maintaining our call center and other operations during this COVID, which means that we are working very hard to also expand vaccinations at the same time that we're doing this. A lot of people have come today. Healthcare workers have come because that's who we're vaccinating and have asked, how can we support what you're doing? We have directed them to the Maryland Responds website. If you Google Maryland Responds, it's a state-run database for volunteers that support the Medical Reserve Corps. You don't have to have a medical license to join that and sign up. We use both clinically licensed individuals who give vaccinations, as well as probably a slightly higher number of non-clinical folks who help us with data entry, moving people efficiently through our vaccination sites. So if people are interested in being part of this, we recommend that they go to that site and sign up. You'll get, if you live in Montgomery County, you'll get a message from our local coordinator as to what the next steps are.
So is this a good way to get early vaccination?
We are providing vaccinations to folks who are working at our vaccination sites after they work there for a certain number of times. So that is an opportunity. But we recommend this right now because it does take a little while to get registered in the system, complete some of the steps, and then we've been reaching out to the MRC. I would say probably about 25% of the staff that were helping us today were MRC volunteers, and they did a fantastic job. We provided the training ahead of time, and they came in and they worked as both vaccinators and data entry. And as we work through this process, we don't yet know how many people we'll need. And I'll explain why. And part of that is right now, with such a limited amount of vaccine, the state is relying on the local health departments to try to ensure that that vaccine is getting to the designated populations. Often we start with what we do and what we don't do. What we don't do at the local health department level is determine who those recipients are, what categories they are, what priority, who's going to be in the first priority, second priority. That is coming from the CDC, and our state partners are endorsing it. Within the state of Maryland, the health officers from all the counties are working together to come up with some strategies, even within healthcare. Which healthcare do we start with, and then which one, and then which one? What we do at the local level is we help to identify the populations that are in those categories and then reach out to them and let them know when it's their turn where to go to get vaccine. Within that, what we do know at this point, we know that healthcare workers, frontline healthcare workers, and residents of long-term care facilities have been designated for that first group. When we talk about the second group, the Tier 1B, this is still within Tier 1, that was 1A. Within Tier 1B, the recommendations from the federal partners have been to include our frontline essential workers. That's where this gets expanded quite a bit. And those individuals who are 75 years of age and older. I anticipate that the state will, again, go with those recommendations and implement that statewide, and we will implement it locally. But exactly who is in those frontline essential workers is something they're still working through, trying to determine where it does the most good. The CDC, when they have their deliberations on this vaccine, not only try to provide guidance on the specific vaccine, who should be getting each specific vaccine based on the clinical trials. For example, the Pfizer is recommended only for individuals 16 and older, whereas the Moderna is only recommended for individuals 18 and older. We anticipate at a future date, they'll have recommendations for younger populations as well. We just don't have that currently. And that does, with vaccinating the healthcare workers and the residents of long-term care facilities, it's kind of a moot point at this point. But eventually, we expect to get additional guidance with that. But they also make recommendations of who should be in these tiers, and they base that on two overriding factors. One is, how do we reduce disease and death from this virus? And number two, how do we return society to normal? So they have focused on that healthcare and the folks in the long-term care facilities, because these are the folks who have been the healthcare workers, because it's how we return society to normal, by keeping them healthy and ensuring that people who become sick and go to the hospitals and go to other healthcare workers can be adequately taken care of. And then how do we protect the people who are most vulnerable? The people who have been most affected in our county and across the nation have been those senior residents of those facilities where the outbreaks have had devastating effects. As they go on for the next groups, this is why the folks over 75 are in the next tier. That's, again, to reduce morbidity and mortality in those populations who have been significantly affected. And that would be the independent living folks who fall in that range. And then, again, those frontline essential workers who are not only potentially exposed to most people because of their jobs, but also could potentially expose people who come into their places of employment. So that's why we'll be working through those groups. Again, we anticipate that the discussions have already included where to put our folks who work in education, right? We want to open our schools back up. We have some schools that are open in some of our jurisdictions, some of the private schools in our county as well. But we want to have all of our schools open up as soon as we can. And this would be a major step. So that is certainly in the conversation. Our transportation workers who are essential are in. Our public safety folks are in these conversations. There's also conversations, again, by all the other groups, whether it is our grocery store workers, or our food and agricultural workers, our childcare workers. These are all in the discussions. We're waiting for these to be finalized and for orders to be created, and then we will share that information out to the county and advise people where they can go to get vaccinated. The promising news. Yeah, I was going to say the promising news with this is that we have more than one vaccine producer worldwide, and we have other ones who are working towards getting approved as well. They're in now that they've been approved, they're in full production of the vaccine. When we get vaccine to a high enough level, certainly that is causing us stress that we can't get it out fast enough. The state is working with our private healthcare providers to be part of that distribution network. Those of you who remember H1N1, that was a major way that people got their vaccine. Their healthcare providers, the pharmacies, other places made it available at a rate that far surpasses likely what is available through our public health personnel. So we're looking forward to that happening as well. And we're just letting you know that to anticipate that when that becomes available, it won't just be sites that we're running that can do that. We will continue to be operating vaccination sites. We have traditionally worked with groups that are harder to reach or that have more difficulty reaching through traditional healthcare networks. We're going to continue working on that and using every resource that we have available to vaccinate people. And we'll continue working with those healthcare partners to make sure that all of our networks are as efficient as possible and that vaccine is getting out to people and out to the end users as efficiently as possible.
And so just to add a couple more points, if I may, the question has been often asked, as we progressively move through the prioritization levels, we don't have a definitive date. Some jurisdictions may move, smaller jurisdictions may move faster from 1A to 1B to 1C. The larger jurisdictions will not move as fast. Also, with the vaccine distribution, there's a base number of 500 doses that's allocated to all 24 jurisdictions based on the population has thus far determined how many doses of the vaccines, and that changes as more vaccines come in. And so we're working on that. We don't have a set date as when we will move from 1A or B or C. We are working towards that end to move as fast as we can. As soon as we get the doses, we are setting up appointments and working with our providers. And as Sean indicated, the public health department will continue to serve as a safety net, but we're looking for our community partners to begin to get doses to help folks vaccinate. And information on the website portal that I put in there will have those spaces or the appointment notification. Two last points. Many of you have heard information about the new strain of the coronavirus. We haven't received any indication from the Maryland Department of Health epidemiologic team that is in the area. We're continuing to monitor it and work with the Maryland Department of Health. The local health officers are meeting daily to talk about that, vaccination, testing, and a whole host of other items as they do on a daily basis or have done for the past 10 months. And the last thing, tomorrow's New Year's. So your public health safety message is, of course, wash your hands, maintain your social distancing, wear your face covered, be in if possible, and you are in a number of X or more, be in a ventilated space. And if you can, avoid any large parties. We are still seeing a surge, holiday surge. And so we need to continue to drive those numbers down. This is one of the primary ways that we're going to be able to stop the spread of a community transmittable disease. Thank you, and thank you, Mr. Lozak.
Let me ask a couple of questions that came in before we get to some of the ones that are being put in the chat. If you could clarify, Dr. Bridgers or Sean, the policy role here. You mentioned it a little bit before, CDC to state, state to county, but I'm a little surprised that some of these decisions haven't been resolved yet as to who gets 1A and 1B and which categories and so on. I understand that once those decisions are made, and if you could explain that policy role, who's responsible for what, that it will depend in part on the availability of the volume of vaccine doses that we have. So there is that part of it. But I would think that the who's going to get what and when should have been decided by now. And if it hasn't been decided, then what are we waiting for? If you could answer that. Second thing is, you said 100 doses last week, 4,000 this week or whatever. Do you have any idea of the supply, when it's coming? When can we expect to see doses arriving? And also, and will you guys be tracking this in a public way so that people who are eager to be vaccinated, as we all should be, can see how things are going and how the line is moving?
Sure. So go ahead, Sean.
Yeah, I was going to, if I could address the prioritization list a little bit. So there, nationally, there's a pretty good idea of who should be prioritized in a pandemic. Those lists have been available, or have been, templates of it have been available for years. The challenge with it is it always depends on the actual nature of the pathogen. In this case, the COVID virus, who it affects. Some pathogens affect young people more so, some affect older people, some affect pregnant people. And so who falls into the different categories sometimes is a factor of that specific disease and what we're seeing. What has been in previous pandemics, what has been used had to be altered. And we always expected it would be altered based on this data. What we've also found out this year is there has been a massive change in how we respond to pandemics. That previous pandemics we have not had. People who can telework now that could never telework before, who are doing that, very much changes the nature of how this is affecting us. being able to do telemedicine has changed it. The groups that are more affected here, and the ravages that have happened in this case with people over certain ages, has very much dictated how not only who should get the vaccine from a disease standpoint, but who needs to get it from a standpoint of preventing the cascading effects of disease. So it has changed a little bit how we do business. Also, how widespread this is versus H1N1 has affected it as well. So and the last part of that is exactly what you pointed out, which is how much vaccine is available definitely impacts how we're doing this. The analogy I've been telling people is we're trying to paint a house. At a certain point, when we have an unlimited supply of paint, we can go about painting that house very differently than when we have such a limited supply. We're like, we're going to do one room at a time. We hope we get to the point where it just gives us a lot more ability once our healthcare providers can start, once there's enough vaccine to involve those healthcare providers in the distribution administration, that will rapidly change how we can simultaneously approach these groups. In fact, the strategy that Maryland has picked to send the Pfizer to the hospitals and to the pharmacy partnerships with the long-term care allows us at public health to focus on moving to additional groups. So they're both priorities at the same time, and they're being addressed at the same time because we're doing it in concert with each other. So I do appreciate that's allowed us to each take different focuses and work at the same time versus trying to juggle all of those groups with just public health.
Will there be a way for the public to track this so that you know where you are in line? For example, we're at 40% of all first responders. We just got another 100,000 doses. Right. We expect to distribute them in the next 2 weeks. Is there a way for all of us eagerly watching to know where we are in line?
So that gets back to the what do we call them on our website? The dashboards that we have.
Right. The data dashboards.
Yeah. Right. I know that we will be tracking this. I just told you, you have the most up-to-date information about how much vaccine we've had come in, 4,300 doses. Dr. Bridgers gave you an update. I can say prior to today, this was our first big clinic. We had done, I believe, about 150 doses prior to today. Today, I think we were closing in on about 1,200 doses at the clinic today. That has not been put up on a dashboard yet. You guys are hearing this first, but we will be tracking it publicly. I know everybody wants to know where we are with it. And so we'll try to be very transparent with that. What we have told people is they've said, why are you not telling us when you're getting it or how much you're getting? It's because we literally don't know. We're still waiting to find out how much we'll get next week and what day it will be. These are challenging decisions the state is trying to do. When they find out from the manufacturer how much doses are coming in, they then have to look at 26 jurisdictions and figure out how to parcel that out based on population, based on other factors. It's been complicated. And within healthcare, it's complicated because every jurisdiction does not have an equal amount of healthcare right now. And the same may be true as we go to the other infrastructure. So there's a lot of complicated decisions, but we will try to keep everybody aware. We're going to try to use the website. Our emails are not really designed to keep 1.1 million people up to date based on email exchanges. So the best way to do it, I can tell you some fraction of 1.1 million have emailed me to find out how they get in on a list. And we don't currently have a list. I doubt we at any point will be able to have a list. What we will do is we will publicize when the next groups are able to go, and we'll use a vetting process depending on which group it is to try to ensure that we're getting it to the right people.
And so we're working through those systems now. I know that Dr. Gales has sent information out to not only our HHS statisticians, but also the statisticians with County Stat to build a dashboard or to add to the dashboards that we use for tracking and surveillance. And so we're building the systems simultaneously as we work. The state system, I see from one of the council members if there's a state system. The state system that we're using is called PrepMod, which is the registration process, which provides you with the appointment information. So that's the state system that we're using. And once you receive your vaccination, you will receive a CDC card, which has the date and the type of vaccine that you receive. Part of the state notification system in PrepMod asks for an email address. And so if you aren't aware of your return date, we're working through the system to receive a notification when to get your follow-up vaccination. Now, one thing that Sean and I didn't talk about as we talk about doses, and the state of Maryland is working through this. So for example, if someone received a vaccination today, and 28 days from now, they're expected to receive their second vaccination, that doesn't impact the daily doses that we have. The Maryland Department of Health is factoring in those doses that will accommodate 28 days from your initial vaccination to be able to receive. So that doesn't cut into the supply, but they're working all the logistics for that. It's slow in coming, and we're managing all of these variables as we vaccinate the providers, as we work with community partners, and as we identify those individuals in those prioritizations and have notification systems in place. We're working with the county's public information office and our comms at HHS and in the comms at the county level to make sure that we have information flooding our web pages and various sites that will identify those those vaccination locations, as well as the appointments that are available. And so we're working those items now as we speak,
So
even after we end this call.
So we can expect one-stop shopping in terms of information on the COVID page at HHS that you put in the chat. And as Sean said, the policy role of CDC will make determinations, turn it over to the state health departments, who will then turn it over to the local county health departments. We understand that you're juggling, but I know that everyone really appreciates publicity, the public information, and providing as much as you know when you know it. Lorraine, what do we got in the chat?
There are a number of questions in the chat about the vaccine. There's also a number of questions about rent assistance and
We'll get to that.
and eviction challenges that we are going to get to. Real quick, people are asking. I'll just kind of toss them out because they're all over, and maybe
Sure.
you can. If people have certain conditions, should they wait for a certain vaccine? Should they only get it at a hospital? So there's a couple questions in that vein. And then also, when people receive a vaccine, does it matter if they have COVID? Do they need to be tested for that?
I can tell you that right now the guidance is not to get, that you don't need to specifically get tested for COVID before you have a vaccine. And if you currently do, if you have been diagnosed with COVID and you are symptomatic, you're not recommended to get the vaccine. In fact, if you're symptomatic with any sort of respiratory illness, whether it's COVID or not, you'll be asked to recover before you get the vaccination. That's a standard vaccination guidance. So we'll ask that we do temperature checks before giving the vaccine. Part of the scheduling the appointment, you have to answer questions about how you're feeling, those natures. We check when you come in because we want to make sure that you're healthy when you get the vaccine. If someone has recently recovered from COVID, from COVID, they are going to be recommended to get the vaccine at some point, even if you previously had COVID. But if you're within the first 90 days and you're in your priority group, you may want to defer until you get out of the 90 days, only for the fact that you probably have some immunity. We believe you have some immunity within that 90 days after you've recovered from a confirmed COVID diagnosis. But yes, people who have previously had COVID, should still get vaccinated once they've recovered. Right now the guidance is to consider waiting 90 days to let other people who don't have any immunity to COVID get vaccinated first. Those folks, though, who have a variety, I know a couple different conditions were listed there. What we recommend for all these individuals is to consult with their healthcare provider. Your healthcare provider has much, much more knowledge about your history. You can discuss it with them, and they can give you much better guidance than we're going to be able to give you because we don't have that background on site. We will have some medical consultants on site to answer some questions, but it just won't take the place of having that conversation with your healthcare provider. If you're pregnant or thinking you might become pregnant in the near future, that's a conversation you want to have with your healthcare provider before coming in to get a vaccination. You can also read there's also guidance on the CDC website, and it does address these a number of different conditions. And so I recommend going to the CDC website, looking for the guidance. As each vaccine comes out, they have information about it that have come from the clinical trials. So people are coming in, you're not the first person to get the vaccine. This has not been approved for emergency use until all these other folks have taken the vaccine first. So I think that answers a lot of those clinical questions about who should get the vaccine. But if there are other ones that I didn't, could you please repeat them?
Sure, and Dr. Bridges may have seen some as well. One asks, is there a website to sign up to be placed on in a tier? And another asked, what makes the new strain more contagious?
So based on the information, I'll answer the latter. Based on the information that we received, that Dr. Gales and I received this afternoon regarding the new strain, is that it's highly transmissible. So if you look at the reproduction rate of the current strain of the coronavirus, this particular strain reproduces at a rate of 1.5 to twice as fast. And so if a reproduction rate is around 1.4 to 1.7, which is slightly higher than the current reproduction rate. The epidemiologists at the state are still examining the data that they received from the UK and even from Colorado. They haven't received any data yet. They're still doing the blood analysis just to look at the reproduction rate to determine that. So as we receive information, I've made a note to see if we could post that on our COVID information portal, vaccine portal, or testing portal, because that's been the recurrent question today after the first news story broke. So you want to take the second piece of the question?
Yes. I just need to be, I'm sorry, I need to be reminded of the second piece.
Oh, is there a website we can sign up to be placed in a tier?
So again, if you go to the Montgomery County Montgomery County vaccine page, there's currently only one group, and there is, like as I mentioned earlier, there probably will not be a sign up to be in a tier. I have to tell you, realistically, it would be very hard for us to manage that. But what we have set up on that vaccine page, there is a link to a survey that is exclusively for our healthcare partners. We are vetting our healthcare partners, through that. But if they fill out, but if there's any folks on the call here who are part of a healthcare practice, we have gone out through the medical society. We've distributed the survey. But we also have a link on the webpage, knowing that not every healthcare provider is in the medical society. And if you click that link, there's a survey that you'll need to fill out and list the address of your of the practice that you work with, so that we can verify it. And that survey will ask some information about your practice, how many people are there, what type of healthcare do you do. So that is the only one right now. And from that survey, we're using that to reach out to our healthcare providers. Again, for I know for the populations that are 65 and over, that is approximately 160,000 Montgomery County residents. just realistically, it's not going to be useful to create a list of those individuals to know when to contact them. We'll publicize, we are now at this tier. These are where people can go to get vaccinations. And then if it's through the sites we're doing, we'll publicize how to make an appointment for that. And then when people come in, we'll verify their age, if that happens to be it, or whatever category they're in. So no, there is not, I want to emphasize, there is not a list you need to get on for these tiers. But if you're in the healthcare industry, there is one place that you can answer that survey so we know how to get in contact with you. We already know who most of our healthcare partners are.
Sean, this sounds a little bit like boarding on an airplane. When you're called, then you can board. So if you're in 1A, that's your first class, and so on and so on. Is that the best way to conceptualize this? To wait for the public announcement of the availability of your tier?
That is a great analogy. I'm going to steal that from you, and I will offer you royalties.
So just to add to that prioritization and tiering analogy that you both used, there was a question in the chat box that asked if I have a predisposing condition and my provider is in another jurisdiction, how will you know? The registration is self-report. We don't access any health information exchange to verify that. We are asking folks to use a higher level of integrity as they complete the registration, and as the information or as your number is called aboard the plane. As we speak now, and as Sean indicated, as we go through those priority lists, I know for the healthcare workers, we just found out yesterday that there have been some scams out there. The folks have been posting the vaccination cards. We actually had someone come in today to say that they were a healthcare worker, that they knew one of the vaccinators. And so we are doing information checks in that regard. As we get into other prioritization or categories under the one tier, there may be other checks and balances in place, but the registration is self-report. So if you have underlying health condition, then please indicate that on the registration form as we go through and we identify those levels of priority.
And I guess just to sum up, the other question I'm seeing in the chat is, if my doctor's in DC, do I go through them? How is the vaccine going to get distributed? Is it going to be through my personal doctor's office, through a community clinic, all of the above?
I think that remains to be seen. As I said, I certainly hope by the time we are in 1B and dealing with a much, much wider group of people, that there are lots of other options than what public health is managing with our partners. So it will be, whether those options include pharmacies at the time or your personal provider or other clinics that are being managed, that does remain to be seen how that is. If we understand that people live and work in different jurisdictions, it's actually the reason why we're using that tool called PrepMod all across Maryland, so that if you go in one jurisdiction and you happen to need to get your second dose in another jurisdiction, that's not an issue. We can look it up. We'll be coordinating with, of course, DC and Virginia as well, to try to ensure that we're able to do this. But yeah, I think you're probably going to end up making the decision when your boarding number is called. To see, I've already stolen it. When your boarding number is called, you're probably going to decide what's the fastest and easiest way for yourself, whether it's your doctor or whatever option is available. It may be public health, it may be a local pharmacy, but we hope to have more information on that over the next few weeks.
So I'm going to put the webpage in the chat for everyone to go to. I think, Sean, when you say survey, it's not really a survey. It's sort of a application test module of some sort. It says to see if you're qualified. Is that what you meant?
There's a link in there. It's about midway down the page that asks a survey. And again, I just want to caution people that is only for our healthcare partners. But when you click on it, it takes you to a Survey Monkey page in which you would fill out that information.
And the purpose of that survey is to screen you, isn't it?
No, well,
it's
no,
for planning.
it's for planning. It's to ensure that we have contact information for our healthcare partners. We work with lots of them, but they're over the course of this response in distributing PPE. I think I know where every dentist office is in Montgomery County now. But there are lots of healthcare partners that we may not have been in touch with, and we want it to be as thorough as possible in getting out to all of them. And so distributing to the medical society, creating this survey, this is a way to ask them, what's your contact information? Make sure we know how to get in touch with them. There's a lot of folks, by the way, I have their phone numbers, but not their emails. So this allowed us to collect that, and then also to collect data on how many people are in your practice, what type of practice. You know, we have such a limited amount right now. We are, again, using some of that state and health officer guidance to try to go to some of the specific types of practices in healthcare that are at the highest urgency level. For example, we're vaccinating our vaccinators, our people who are giving vaccinations. We have to protect them, or else we can't perpetuate vaccinations. Our EMS providers are in contact with highly vulnerable patients all the time, and we have such a limited number of those providers. They have been getting exposed and getting sick because they work with sick people. So we're trying to vaccinate those groups. So again, we were using a survey to make sure we know how to contact as we progressively go through our healthcare groups, what type of healthcare they do, how many are in the practice, and how to get in touch with them. So that's very specific to that group. As we get to much larger groups, we're probably not going to use this sort of survey thing. It's going to be a much wider outreach. Some of the essential worker groups, we'll be doing targeted outreach to those groups.
Okay, Lorraine, do we have any other questions for Dr. Bridges or Sean O'Donnell? Both are welcome to stay for another half hour or so as we get to our renter issues and subsidy questions. Other questions might come around. Is there a way for we put the website in the chat, but is there any appropriate way for people with questions or specific questions? We know there's a large volume out there, but is there a way to contact you all or HHS, or are you dissuading people from doing that and asking them to simply look at the web page, stay updated, and understand that you are extremely busy right now in the middle of a national emergency?
I would yes. yeah, that is the way to go. Understanding the information is changing at a national level on a daily basis. I learn about a lot of things in the news. I often can't get it to you faster than that can. Everyone's focused on this right now. Of course, what you see in the news, check the second source to make sure it's accurate. But the CDC webpage is a great location for updating information about vaccines and about lots of very, very useful information. We're going to try to keep our webpage up to date with local county information about how this affects you in our county. And if you have something that is of, obviously contact your healthcare provider if it's of urgent nature. But our call line that Dr. Bridges shared earlier, they are doing lots of work with the testing going on in the county and getting people their results. If you have sort of general questions of medical natures, those are probably better answered by your healthcare provider or looking up on the CDC website to see if they have the information you need. But otherwise, some people are calling through the call center, and we're sometimes able to get them information. A lot of people are saying, when will I get the vaccine? Where do I need to sign up? and our call center is letting me know we're getting lots of this. Everybody's letting me know we're getting lots of these questions. And we unfortunately, we've shared with you the latest information. We don't know specifically when each group will go. We're trying to share some vision of what that order will look like, but when is dependent on how quickly we get a vaccine and how much vaccine we get to move into each of those phases. And that will be clearly available on the website, probably through the media. I'm sure there will be press announcements on these different turning points. We will try to be in concert with our neighboring jurisdictions as we move from one phase to the next, as much as possible.
And we will include that information updates from your website in our communications to the renter population. Again, I would ask the renters and folks listening to do your research first, CDC website, as Sean indicates, and the county COVID website, to make sure. And I know we hate this when you go on a recorded line and you have to press 6 different buttons before you get to the question you want to answer. But what they're really, in this case, we really do need you to screen yourself out by doing your own information acquisition first through these websites. And then if you still can't find an answer, then Dr. Bridgers has unfortunately opened the door to your calling him. So you could use that number, but bear in mind that these people are very busy and this is an extraordinary time and an extraordinary emergency. So we thank you very much, Dr. Bridgers. Thank you, Sean O'Donnell, a public health emergency manager. And we hope we might have you back again as things evolve, where you can keep us up to date and informed. But thank you very much. We will now turn to,
Thank you.
You bet. We will now turn to the Deputy Director for the Department of Housing and Community Affairs, Frank DeMarais, who will give us an update on the rent subsidy program, what subsidy program, what subsidy information is available, what subsidies are available, and also what resources are available through the Office of Landlord and Tenant Affairs and with code enforcement. Frank?
Okay, thank you, Matt. And I also want to add my thanks to Dr. Bridgers and Sean for that, all that critical information that complements everything else that we're doing here in the county. So, the first thing that we stress is that the county is open. Our offices are closed. The county's open. Our health department is open and operating, but our Office of Landlord Tenant Affairs, our Office of Code Enforcement, the Department of Health and Human Services providing services are all available to you, and we're going to review for you this evening in short summaries the key information about what's going on in the current COVID-related emergency, but we really want to answer your questions. So we're going to try and keep the summaries very short. Rosie McCrae Moody is going to do an outline of the landlord-tenant court and other specific landlord-tenant law and rules that are in place and things that you should know about it. Ken Nichols is going to address how we're operating in the COVID environment on code enforcement. And then we'll give an update. I'll give an update on the rental assistance, where we stand on it. And then we'll work to answer any and all questions we can this evening. So Rosie, if you can provide some update.
Hello, everybody. Here we go again. Let's see what's going. The district court had opened, and then when the number spiked up, they closed again. So they're closed through January 15th, and the only thing they're hearing in terms of landlord tenant are emergency breach of lease cases. So those are cases where there's a threat to health or safety. So if there's somebody in there threatening to kill somebody, or there's mold growing up on your walls, they'll hear that. But other than that, they're not hearing failure to pay rent or tenant holding over or anything like that. They're not hearing that. So if you were scheduled for something before January 15th, the court is going to reschedule that. So you have time.
So, but they should call the court to
They still have, you can call the court, have your case number, because sadly, it's the only way they can look up your case. I'm not going to get into why I think that's kind of crazy, but that's the only way they can look up your case. So please have your case number. It's in the upper right-hand corner of your notice for failure to pay rent. The CDC order has moratorium on evictions has been extended through January 31st. So under the CDC order, you still can't be evicted through January 31st. Now, even if you went in and you got a judgment, it's been stayed. So nothing's going to happen before January 31st. And honestly, the backlog is so it's going to take a while. Even if you got a judgment, it's going to take a while for them to get to you. The governor's order is still in effect. And so if you are sued for failure to pay rent and your loss of income is due to COVID, you still can't be evicted. So you have two protections right now on the failure to pay rent front. If you just get a notice to vacate and you don't leave on a tenant holding over, you can still, your landlord can still sue you, and sadly you can still be evicted for that, but it's going to take a while to work through the system because the system is just slow at this point. But you can be evicted for that.
Rosie, can you please explain the three categories with failure to pay rent, breach of lease, tenant holding over? What are the differences?
Failure to pay rent is self-explanatory. You didn't pay, and they're suing you for what you owe. Right now, under CDC and the governor's order, you cannot be evicted for that if that failure to pay rent is the result of lost income due to COVID. Tenant holding over is the landlord told you to leave and you didn't go. And probably because you didn't have the money because you lost your job because of COVID. But, and that could be a case you can make in court, and that would be up to the judge. But that's tenant holding over. And you can still be evicted for that. And breach of lease is you've done something in violation of what your lease says. And it has to be a relatively serious breach of lease for the judge to evict you, because the judges don't like to separate people from their house. And so if the landlord is suing you for breach of lease for something relatively minor, the judge probably won't give you a judgment for that.
So I just want to, you mentioned two things. I want to make sure there's no confusion. But if you get an order to vacate from your landlord, says we want you out in 20 days or 30 days, first of all, does not have the force of law, so that's not illegal eviction. No,
you still have to you can only be evicted through court order.
And if your lease expires, that is, your lease is over January 31st, and your landlord does not renew your lease and instead gives you, in Montgomery County, 60 days notice before the 31st that your lease is not being renewed, you could be evicted for tenant holding over after the 31st of January, and there's no protection for that.
No, but after the 31st, the landlord cannot sue you until after the 31st. If your notice expires on January 31st, he can't go to court until February 1st. So he can't even sue you until after the notice expires. And then he has to get a date, but you are still subject to eviction. And then he has to go to court, get a date, and go through the process, which is not quick, but you can be evicted for it. So right now, everything is plodding along, kind of slow. So if you're way behind in rent, and landlords have gotten, they know they can't evict you for failure to pay rent. So a lot of times they're just waiting you out. They're just waiting for leases to expire, because you don't have to have a reason to tell a person you're not going to renew their lease in Maryland. Not just Montgomery County, in Maryland. I think except in Tacoma Park, you don't have to explain. You can just say, I no longer wish to keep you, and give proper notice of it, and they can put you out. Take you to court and have you evicted. So, so that's the state of that. So if you're in that position, my advice to you is work with HHS, with Renters Alliance, CDC, CASA, and the other organizations to try to work something out with the landlord if possible. Otherwise, try to save as much money as you can, So if it gets down to it and you have to go, you'll at least have something to go with. And then right now, I think those are the main things that are going on. Yeah.
And again, we very much will focus on your questions. So please, keep adding questions to the chat.
Yeah, and I've been trying to keep up. And if you want to contact, we're on duty 8:30 to 5 daily. So call 311 and an investigator will call you back. We usually call you back within 8 hours because there's somebody on duty every day. Now, if we call you and we call you at least 3 times before we give up. So please, Ulta Intake, you can send us an email or you can call 311 and we will get back to you.
Okay. And let's, at this point, we'll get an update on how we're handling the housing code enforcement and helping to protect your property.
Hello, everyone. So as Frank indicated, definitely open for business during the last several months. Obviously, our operations have had to change. We're not physically going into units on a systematic basis doing our proactive inspections. We are responding to complaints. We typically will try to make as we would always do, a phone call, but then a video call or obtain some photographic evidence. In any scenario, whatever things you would have complained about in the past, pre-COVID, give us a call. If we determine it does need an inspection, we'll send you out a notice with precautions that the inspectors will take and we ask management to take and for you to take so that inspection can be made safely. As it goes with a lot of complaints, I'm actually just typing a response right now to someone about mask wearing. We are helping HHS out. They oftentimes are the first ones that get a complaint regarding lack of mask wearing or signage, required signage, cleaning that's supposed to be being done on a daily basis. If those things are not happening, we will go out, educate the property owner. In those cases where masks aren't being worn by the management or their maintenance staff, if they get a second call into the county, someone from HHS may go out there and actually issue a citation to the property owner. The question was asked here, and I guess I'll answer it here, is about tenants wearing masks in public spaces, and that's unfortunately very hard for anyone to monitor. Imagine in a large apartment building, there could be thousands of residents. There unfortunately is no way to enforce that. What we do is we make sure that the property landlord manager is following or leading by example. They must be wearing the mask. And of course, we encourage you, in a very non-confrontational way. I know I live in an apartment building here in Montgomery County, high rise. Sometimes people, and I'm not encouraging this, will give their neighbors a dirty look. Others will just gesture, and oftentimes that might be enough. A person might have a mask on them, around their neck, but just do this gesture here so that they, pull up their mask. But yeah, we're open for business. Call 311. Code enforcement, we have a limited number of officers actually going to be joining HHS on some training next week so that we can be deputized to do some enforcement as well in the community. Yeah, that's about it that I have for code enforcement.
Frank, could you just address the what we discussed earlier about the health department's mandate about mask wearing? It has come up quite a bit. We know the enforcement challenges, but what is the rule?
Well, the rule is the county's health office has issued a requirement, and the enforcement is the hard part, but the requirement that everyone wear face covering when they are in the presence of others who are not a member of their immediate household, where they cannot maintain 6 feet of distance. So this is in all settings, indoors and outdoors, anywhere in the county. So they made it very simple that if you are going to be in the presence of others who are not a member of your household and not able to maintain 6 feet of distance, it's mandatory by health guidelines So this is then a statement of mandatory, and we have made available, as Keen said, posters and support materials for properties to be able to put up to say this is Montgomery County policy. And that's something that can be reminded of, your neighbors and others. It is just a very difficult thing for anyone to structure any enforcement around.
But to expand on that a little bit, that includes elevators, community areas, hallways, community spaces in apartment buildings. People are expected to wear masks according to the health department policy.
That's correct. And that information is available. We should highlight at the Department of Housing Community Affairs website, which we have all this renter support information on the COVID situation at montgomerycountymd.gov/renters. So it's the main county website with a /renters. And there's information in there about COVID management and cleaning and face masks, face coverings for property, and it applies to all properties, irrespective of whether or not it's a retail or a residential.
Lorraine, I'm going to ask this question because I love this question for Rosie. If you're given a renewal notice, can the landlord rescind the renewal notice and say, I'm not renewing your lease? And I imagine if the landlord believes that, it would also be all right for somebody who's got a lease to give me 6 months into a 2-year lease and say, oh, I changed my mind. Even though I signed it, I don't want to agree to it anymore.
The landlord offers you a renewal and you accept it, he can't then go back and say, well, I changed my mind.
But even if you don't accept it when you're in the consideration period, he can't rescind the offer.
Maybe, maybe not. But if he does try, file a complaint. Because I feel like once the offer's on the table, it's on the table. So unless you do some terrible thing to make him rescind the offer, he should honor it.
Right. You'd have to be able to justify that. Lorraine, what else we got?
Well, Matt, if you don't mind, I'm going to give an update on the rental assistance.
Oh, forgive me. Of course.
So, and again, thank everyone for participating tonight. We're going to share this information, and please share it broadly. But the county has conducted and had an open application process that went from September through the first week of December. We had allocated funding for up to 5,000 households to receive rental assistance. It was closed down the first week of December, and a waiting list has been established. And so the COVID rent relief, and this is also available linked from the Montgomery County MD.gov/renters, and the COVID rent relief site. It's on the Department of Health and Human Services main site, but you can register your interest in future available funds. For those who applied prior to December 2nd, all of the letters have gone out to those who were accepted or determined to be ineligible. And some of the letters got returned and they're getting researched to be remailed out. So anyone who applied should have received or be receiving through the mail with the slow postal service at the end of the year notice of that. Funds will be paid out through the first couple of months of this year as they work through it. Your notice alerts you that if you've been approved conditionally, a case manager will call to review the details with you and confirm and make sure they have all the right information and documentation and the landlord connections. So if you get a letter, you should then subsequently get a telephone call. And the advice is to pay attention to the calls coming in. They may be from personal numbers as well as county numbers with staff using their cell phones. So that process, we hope, will achieve the money, which totaled over $20 million going out through by the end of the first 2 months, by the end of February, all those funds getting out. The Congress and the bill that was passed on stimulus have allocated additional funding for rent relief. We do not have final details. We expect that Montgomery County will receive an allocation, and there's funds in that $900 billion stimulus package that are earmarked, dedicated for rental assistance and we'd expect that to be available to us within a couple of months. So we do have a period right now where we are not taking applications, but we do have, through the Department of Health and Human Services, a place to put your information, contact information. You don't fill out an application, but you are then going to be contacted when additional funds become available. While we don't have funds, and even when we do have funds, it's critical to do everything you can to manage your situation with your landlord. Not everyone is going to be eligible, and even those that are eligible, the funds are not going to answer all of the need. And so what Rosie spoke to earlier, Office of Landlord Tenant Affairs is available. We can work with you, with the county government staff. Also at that website, the /renters website, is a list of organizations, nonprofit organizations under contract with the county, including Renters Alliance, who will share with you information, who will support you understanding your rights, but also information on how to work with your landlord or how to manage the process if you are facing any eviction notices. So it's going to be a period of time here. We know it's very difficult. We don't have money today. When we do get money, it will be available to some, and not everyone will be eligible. And for a lot of folks, it won't be enough money to handle all of the rent that's owed. So what we'd like to continue to recommend is engagement as best you can with your landlord, to work in the idea that you should find some way of arrangement. Any amounts you can pay, the rent is due, reducing the amount that might be owed when some assistance becomes available or additional income becomes available to you or your household. And we do have the counseling resources to assist you with that. You'll also see there the phone and the contact for Maryland Legal Aid. That is available to persons that get a notice, a summons to court. So once you have legal action taken against you, you will be able to get legal assistance, advice, representation for your court event. For when you have to show up in court, you can be represented by the Maryland Legal Aid, supported by the county and the state. And they can give you advice. Rosie spoke to the eviction protections under the governor's executive order, how to bring documents, what to show to the judge, what might qualify to allow a stay until the end of the eviction, the emergency period. But it's very important, and we're just sharing it now, but to share it with everyone to take action early, prepare for what might happen, and we hope that we can continue to provide that kind of information and support. So that's where we are with the rental assistance and the other kind of ongoing information and rights understanding assistance.
Frank, are you able to answer now, or is it still in limbo, whether people who received funding before will be eligible to get funding again?
No, we have not seen the rules for the new funding. We're hoping that it will be as flexible as it was under the previous CARES Act money, the 21 million. We were able to provide assistance to those who had received previous assistance, as well as some flexibility in how to document the household situation. The Congress has not determined when they will get us the rules that go with the allocation.
All right, thank you, Frank. Lorraine, are we ready now to go to questions?
Yes, there are several different kinds of questions. The first one I see is someone is asking about the process timing of eviction. For example, if you're in an apartment and the lease is expired and you're behind on rent, and your landlord is telling you they want you to go, what's the workflow of that eviction process? How much time do they have? And then secondly, who can they contact to get help because they don't have enough money to pay the full rent?
If it's failure to pay rent, the landlord has to take you to court to evict you, take documentation with you to your court date to show that your loss of income is COVID related, and that will be stayed. If it's just a tenant holding over, still take that to court with you, and the judge, it's up to the judge whether or not he'll take it into consideration. Legal aid is supposed to be in court to help you as well. And in terms of financial assistance, you have to contact Health and Human Services. And they can connect you with other community organizations. And depending on the amount you owe, if it's not a really high amount, they may be able to put together enough money to, you know, pay your debt.
Yeah, and I think what you're saying, Rosie, is anyone who receives a court summons should call 311 and in order to get connected with what's called housing stabilization support. So housing stabilization is a separate pool of money. It's not a rent relief application, but it is funding available to help offset some of the funds owed to avoid eviction and homelessness. And so 311 and learn about the housing stabilization availability, as well as contact Maryland Legal Aid as soon as you receive a summons, and they'll guide you with how to prepare for that court date.
And then just to follow up in terms of the timing of the courts, there's been a lot of discussion about this protection lasts this long, this protection lasts this long. From today going forward, what kinds of timing wise protections do people have? And if they feel like their landlord is looking at trying to evict them, how much time do they have of protection while they reach out to these support groups and get their situation in order?
I can't sit and give you a date definite. So all I can tell you is they're not hearing ready to pay rent until after January the 15th, or tenant holding over, or just the normal breach of lease. So you have at least until January the 15th. And then even when you get to court, judgment has to be issued, and there's a process. So you have a little time. I can't promise you have 2 months or 6 months. I can't do that. I just can tell you that you have at least until January 15th. You have to go to court. You have to get that order issued, send out the warrant of restitution, set up a date and time with the sheriff. You have some time because the courts are backed up and it's just not a quick process. You don't have forever, but you have a little time. And so if you know that you're behind now, contact rent stabilization, do whatever you need to do. Don't wait until the last minute. Please don't do that.
Right, and you can also reach out to us if you like. I put info@rentersalliance.org in the chat if you are concerned. Also, I'd like everybody to keep in mind that one of the things we're juggling in terms of being able to assess what process is happening is this pandemic. And if the pandemic continues to worsen, as we're seeing now, that will tell us about how much longer these eviction or emergency eviction orders will remain in place and what the court will decide to do in terms of hearing these cases. So unfortunately, we're all juggling, trying to see how things evolve. So, but don't sit back. Don't let it, put it in a drawer and forget about it. Don't do that. It's your housing. And if you know something's coming down the pipe, as Rosie says, deal with it early. Sorry, Lorraine.
No.
I'm going to add one more thing. We spoke early to the CDC moratorium. This is federal, that was extended by this new stimulus law through January 31. New administration could very well extend that. As Matt says, these things evolve. But just to be clear, that is something, there's a form called a declaration, CDC declaration, available at the website we mentioned, the /renters, also available at the CDC website. You fill that out, hand it to your landlord, and that is what protects you in court against an eviction for failure to pay rent if you have, and state that you've had COVID, loss of income. And so that's available through the end of January. And if the new administration coming in extends it, that could be a very powerful tool in addition to showing in court the loss of income to a judge under the governor's order. So these are things that need action ahead of time. And I just wanted to share that.
Okay. Here's a question about utilities. If someone is behind on their rent or their lease expired and their landlord is wishing they weren't there anymore, is it legal for the landlord to cut off their utilities without a court
Under no
process?
circumstance, no.
And so what sort of support or what would you recommend that somebody do if this happens to them?
Call 311, ask for code enforcement. You can't cut off a person's utilities.
Okay, and then again, if they also have rent concerns,
Because they can be issued a citation for that. And that one is not, I don't have to wait. You don't have the right to do it. And that's an emergency. And code, King can address this one. But the landlord can't go and cut off your heat or, cut off your electricity or cut off your water, because you have to have those things to live there. And if you don't have them, then your unit is not habitable.
and then from a broader perspective, that person could also reach out to Renters Alliance or one of the other support
They
groups.
can call landlord, tenant, they can call
311.
Renters Alliance, yeah, but 311, and they need to call code, because code can go right
So-
out and say, hey.
So the
No.
website I keep posting has the list of phone numbers of all these groups. You can choose the one you're comfortable calling, and they can help you, in addition to Rosie's recommendation to call 311 for code.
Rosie,
Okay.
does anybody know if the utility companies can cut off utilities if you haven't paid your utility bills at this time?
You can now cut off your utility, but you have to give notice. They have to give you, I think, 45 days notice. And if you call and make arrangements, make payment arrangements, they have to accept it.
Can they do it during the winter?
They don't generally do that. I'm not sure about the law on that, but they won't usually cut off your heat, during the winter. And the PSC has said you have to give a 45-day notice. And if the tenant calls and makes some kind of payment arrangement, that utility has to accept it.
That's the Public Service Commission that oversees the utility companies.
Okay, there's a question about legal help. What kind of lawyer helps tenants who need to litigate against their property management company for someone who's nearly exhausted all their options and health and safety is at risk? What legal resources can they turn to for advice?
Legal aid.
And the legal aid phone number is at that website.
Yes.
I guess there's a number of questions about financial help. I know Frank has talked about, going on the website and putting your name on the wait list. Is there any other advice about people who need financial help?
Unfortunately, there are just a lot more people in need of financial help than there are programs to actually help everybody with that need.
And then
So
the need,
access whatever is out there, and that's the other reason why you shouldn't wait till the 11th hour. You may be able to cobble something together, but not if you wait until the last minute.
and from the public side, from our side, we very much believe that we will be seeing some additional federal resources. So we do recommend applying, or not applying, but putting in on the waiting list to make your need known. And as that becomes available, it'll be a couple of months, probably, just the way things are working with the Congress. So no, there's nothing in the short term other than what we mentioned earlier. Once an eviction action is taken in court, then the county does have some emergency funds to try and offset or to mediate just to avoid the eviction actions. But the financial rental assistance, we don't know the full amount and we don't know the terms, but the package that was passed in the Congress is substantial, and we expect to be able to get funds going as soon as that becomes available to us.
But that will be for some of the people, not for everybody, so pay attention. Also, keep in mind that, again, that part of the subsidy program is not just to help the economy and to keep people housed because we're facing eviction, but also because of the pandemic. And it is very dangerous to society at large to have people unstable, moving in with relatives, moving from home to home or friends. This causes virus spread. So this is another major consideration of why these funds are being made available. So we will keep track. You all should keep track. And we will, again, have more town halls with updated information as it becomes available.
Regarding the CDC moratorium, which we know has been extended to January 31st of next year, how strict are the criteria to get the protection under that? And does it apply to failure to pay rent as well as holdover cases?
The CDC moratorium is not as strict as the governor's moratorium. So you can basically just declare that you've lost income because of COVID. You don't have to physically prove it. Under the governor's moratorium, you do. When you get to court for failure to pay rent, you need to have some documentation to show that that's really what happened to you. Under the CDC, you do not. You can just declare it. And it does apply somewhat to the other thing, because the CDC doesn't want anybody evicted because it's a safety issue. They don't want people homeless during the moratorium, during this pandemic.
And the form that will detail the declaration that you're making is available on our website, /renters, and it's also at the CDC. And you have to sign that, and you're stating, and it does say under penalty of perjury, that you're stating that you've lost income, that your household income is below a certain amount, which is 99,000, and that you have made efforts to obtain any assistance available, and you've made your best efforts to make payments to the landlord. So there's a form, and then you have to sign it and deliver it to your landlord, signed by all of the tenants on the lease.
And take that to court with you if on your court date. You're on mute, Lorraine.
Sorry, I see about a half dozen questions here. I'll try to go through them quickly. I see a question about if my landlord has filed for eviction, it hasn't gone to court yet, etc., and I'm trying to find another apartment, is that going to be a problem? Is that going to be something somebody will be able to see?
Once the landlord files against you, it's basically on the record. And so it follows you around. Now, because of COVID, because of the situation at this point, a lot of people have that on their record. So landlords can take it into consideration, but they may not give it the weight that they normally do, considering the situation that's here. But moving is going to be more difficult simply because you're going to have to be able to demonstrate that you can pay. And they're going to be more reluctant to take you if you can't demonstrate that you can pay.
If I want to rent a townhouse, is there any way for me to look up online to see if the mortgage on that townhouse is in default, if I'm going to have a problem with that?
No, there's no information about that in the public realm.
I know we don't have a crystal ball about when these moratoriums might get extended or not, but from the time, if the landlord files to take you to court to the time you get called to court, receive a judgment, and the sheriff comes, how long does that usually, what is some ranges to give a sense of that time frame?
I honestly can't give you one. It's especially now because court just isn't, it's not regular. It's not regular court. They're not hearing a lot of cases on it. Normally they could hear a lot of cases in one day. Right now they limit how many cases they hear in a day, how many judgments they pass out. It's slow. It was slow in the beginning. It was a slow process. It took like six to 8 weeks. And now I guess it's going to take a little longer than that because with all the delays and, it takes a while. I can't give you a number because I just
They're
don't know.
not hearing cases that aren't urgent right now. So
They're not hearing cases that are urgent, and even when they hear them, you know, the process is just moving slower than normal. They're not hearing the same amount. They might have heard 40 cases in a day under normal circumstances. Now they limit it to 12. So do the math.
Okay, one person says, does Montgomery County have a system in place to house someone experiencing violence in the home?
Yeah, you can go through emergency services. They do have programs for that.
And how would someone find that?
You can always call a crisis center is available 24 hours a day, 7 days a week.
They can do that through 311, can't they? Yeah.
Yeah, and what's the other number?
You can also go to the
777-4000,
HHS
yeah.
website and look it up if you're able, but if you call 311, say specifically what your issue is and make sure that they direct you to the right place.
In terms of maintenance and cleanliness, I'm switching over to code questions. In terms of maintenance and cleanliness of the building, how frequent are the inspections now during COVID?
Yeah, so I answered that one. Our inspections that we do with the Department of Housing and Community Affairs, of apartment communities, it varies depending upon the nature of the building. So troubled properties get inspected once a year. Properties that are at risk once every 2 years, and then compliant properties once every 3 years. So we don't actually go to the buildings proactively on a regular basis. Even if it's a troubled property, it's once a year. Because of COVID right now, all interior unit inspections have been stayed. We have and are continuing to go do the common areas and the exteriors of our properties on our triennial list. But you know, the best thing is if you've got something going on inside of your unit, please call 311 and we'll follow up promptly. If it's occurring in the common area or the exterior, we will likely conduct an inspection. But again, regardless if the violation is in your individual unit, even though we might not conduct a physical inspection, we will follow up. We will still issue the property owner notices, and the owner, if non-compliant, could still be issued citations.
Okay, those are all the questions I see, unless somebody else sees something I might have overlooked.
One more thing. The number for the crisis center is 240-777-4000.
Right. Frank DeMarais posted that, and I posted the link to the abused person's website on the Health and Human Services Department website, where you can also find information. Don't wait in a situation. Please get help if you need it. Don't be shy. It's important. Okay, well, we usually only go till 8:30. We went a little bit longer because it's an emergency. We're in COVID time. Things are unusual, and there's a lot of important information we'd like to get out there. But at the same time, many of you have dinner waiting or a glass of wine, whatever it is. We want to respect that. So I want to thank our panelists, particularly Dr. Bridgers and Sean O'Donnell for their presentations on the vaccine. We will bring them back when there's more information to provide. Of course, always our friends and colleagues at Department of Housing and Community Affairs, Deputy Director Frank DeMarais, Office of Landlord and Tenant Affairs, Rosie McRae Moody, Supervisor at Code Enforcement, Keem Nichols, and Public Information Officer Lorraine Driscoll at DHCA, who keeps me sane and tracks things to make sure we don't go too far off the rails here in these renter town halls. So thanks to all of you. This is a living discussion. It doesn't begin, it doesn't end. We're going to continue it. But thank you, everybody, for joining us this evening, and good night.
Good night.
Thank you,
Happy
Matt.
New Year, everybody.
And Happy New Year.